Hi there, Dr. Scott Martin here, and today we will discuss everything you need to know about polycystic ovarian syndrome and compare it to polycystic ovaries and ovarian cysts. I hope to do this clearly and succinctly without drowning you in medical jargon and confusing terminology. We'll also talk about what the best treatment options for polycystic ovarian syndrome are and what your doctors may or may not have told you. But let's start with what you've been diagnosed with and what to worry about. If you've been told you've got an ovarian cyst, no need to worry, this is normal. If you've been told you've got polycystic ovaries, no need to worry, this is also normal. If you've been told you've got polycystic ovarian syndrome, then this is a problem, and interventions to remedy PCOS will be necessary unless you can lose 5 to 10% of your body weight and change your lifestyle to maintain this weight loss. If you can do that, PCOS can just magically vanish. Other cysts that are a problem, there are things called dermoid cysts, cyst adenomas and endometriomas. If you have those, you may require to have them surgically removed, but mostly they're not too much of a problem. But what are the tests done for these? How do you know if you have them? Well, blood tests, ultrasound and surgery in the form of laparoscopic ovarian diathermy are available. But let's first start with what a normal cycle of ovulation looks like so you know what's supposed to happen. And then we will discuss how and where these things go wrong. Looking at the picture, you can see your ovary starts by recruiting a primordial oocyte, which is a medical way of saying the beginning of an egg. AMH hormone is introduced, taking the egg from a baby to a teenager, as seen here on the picture, as growing follicles. Follicular stimulating hormone takes over and turns the follicle from a teenager into the prom queen, ready to be ovulated. Luteinizing hormone then follows, and the follicle is now an ovulated egg or a secondary oocyte. And the corpus luteum is then produced. The corpus luteum is like the part of the plant that holds the flower to the stem, also known as a calyx. The corpus luteum is ultimately absorbed by the ovary and dissolved. Now we know what naturally happens in the ovaries every month. We will discuss what can go wrong in the next video. I'm Dr. Scott Martin, thanks very much for watching.